Now coming to what are the treatment options of chronic kidney disease. I'll be telling about the general overview treatment of the chronic kidney disease. The first and the foremost thing to treat a chronic kidney disease patient is to identify the stage of the chronic kidney disease and to identify the cause of the chronic kidney disease, like what has caused his chronic kidney disease, like whether it is diabetes or hypertension or it is stone disease or an autoimmune disease or is it a congenital disease or which runs in the families, or is it a urinary tract infection. So first we will identify what is causing the chronic kidney disease, because if we identify the cause and halt that process which is causing the chronic kidney disease, we may stop the progression of the kidney disease at that stage. Okay, so that is the most important thing. So for example, if the patient has diabetes, so we will try to control his blood sugars strictly and we will try to keep his blood pressures under the control. So this will somewhat decrease the progression of the kidney disease, but it will not end there. So there are many other treatment things which we have to do in these chronic kidney disease patients. The other things which we do is, first we will try to control his diet. With the chronic kidney disease patients, we advise generally less than 1.5 liters of water per day, and along with that we have to restrict salt in these patients, because excessive salt will lead to excessive load on the kidney and it will lead to further damage in the kidneys. So we will ask the patient to take approximately up to 5 grams of salt per day, like a small teaspoon amount of salt in a whole day, including everything which the patient takes, which has to contain less than 5 grams of salt. And the patient has to take more of vegetables and fruits compared to animal food. So we will ask the patient to cut down the animal protein, and we will ask them to take more of the vegetable or the plant sources of the protein. So these are the important things. And then we will ask the patient to increase their physical activity. And then the other things which we will do to halt the progression of the chronic kidney disease patients is, we will try to measure their calcium, phosphorus or the acid content in their body. As the kidney failure worsens, the acid accumulates in the body. So indirectly these acid accumulation in the body can be measured by measurement of the serum bicarbonate in the blood. So if the serum bicarbonate is very less, it means that more amount of acid is present in the body. So we treat them with some medications to increase this bicarbonate or to decrease the acid in the body. And we will also give medications to keep their calcium, phosphorus levels in the normal range. And we will measure these hemoglobin in these patients. So as the kidney failure worsens, as I have already told, the kidneys will help to maintain the hemoglobin levels in the body. So as the kidney failure worsens, hemoglobin will fall. So to maintain the hemoglobin levels based on the stage of the patients and based on the hemoglobin and based on the iron multivitamin levels in the body, we will sometimes give them some injections to keep their hemoglobin in the target range. These injections are erythropoietins. The other thing is the dialysis treatment. As the kidney failure worsens, if the patient goes into stage 5 and they develop symptoms like if the patient has decreased urine output, or if the patient develops symptoms of weight loss, weakness, loss of appetite, excessive itching, so these patients require hemodialysis as a treatment option. So without hemodialysis, these symptoms will be worsened and none of the medications will improve these symptoms.